The United States is currently in the midst of an opioid epidemic.
It's affecting everybody, and it doesn't matter what walk of life you come from, what your income is.
About 4 years ago, in 2015, the governor convened a task force across the medical schools asking us what we could do in order to try to address this from the perspective of medical education. And the 4 state medical schools worked together to develop 10 competencies that we thought all graduating medical students should be competent in by the time that they left medical school. And at UMass, because we also have a graduate school of nursing, we immediately expanded that to our nursing students because they prescribe opioids as well.
When they came back from Boston with the 10 competencies, they said, this has to be interprofessional. We graduate prescribers, from medicine and from nursing.
So we have a lot of partnerships with the local community regarding helping with training and engaging students in the medical and the nursing school in community programs.
The statistics of Worcester showed that our rate of overdose and fatal overdose was higher than the state's average, dramatically higher.
Through this program, one of the gaps that we identified in our curriculum was providing our students with exposure to patients who are suffering with opioid misuse.
We reached out to our local health department and we reached out to several programs that are in play, and we actually engaged them, and from that we developed a panel, and that's part of our curriculum, this innovative curriculum. When it comes from the patient's own words and you're able to talk to them, it just makes it very authentic and very real.
Our students actually, when they're doing their opioid curriculum, they're in the rooms that look like ambulatory clinic rooms. And so they cycle through 4 different standardized patients who have very different scenarios. While we worked with faculty from across multiple disciplines to create our cases, we also then have asked for patient input. So are these cases realistic? Do we have what we like to call the emotional authenticity and the medical accuracy in these cases?
We actually have the faculty talk with the students about, their thoughts, their perceptions, and debrief a little bit about what they heard and what they thought.
Our curriculum could really be implemented anywhere.
The thing is, you have to innovate so that you can create the curriculum for the students that you have and the tools you have.
But we really need to grow that into changing our healthcare system so that the people who are working actively within it have more resources in order to help deal with the opioid epidemic.